Hang on. Okay. Hi, good afternoon, Dr. Timothy. How are you doing?
Hi, I'm fine. Thank you, Dr. Prem. Nice to see you.
Yeah, we don't get to see each other face to face often.
Yeah. Make sure you don't cough or sneeze in front of me, okay?
Yes, I will try. I will
Can
try.
travel through the computer.
Yes. Actually, I wouldn't be surprised if that happens soon. Huh?
Yeah, yes.
Anyway, thank you very much for joining us, Dr. Timothy.
Yeah, yes.
It's very nice of you to take your time off. I'm so used to calling you Timothy, now it's struggling to call you Dr. Timothy.
Oh,
We've
you
been
can call
friends
me
for a while.
Timothy. That's fine. Yeah.
Yeah. So over the last few weeks, and we have been having some very interesting discussions with professionals on Facebook, and we started this program with the intention basically to educate ourselves, on the whole MCO thing, the disease thing, and how it has affected people, mankind, and also finally we like to send a message on what we can do now to prepare ourselves post this
Yes.
whole pandemic. And I thought, with your expertise in infectious diseases or communicable diseases, it'll be very interesting to hear from you, Timothy, especially now when we seem to think we are coming closer towards the end of the, or so-called the, coming out of the MCO or the movement control order period. And yeah, it'll be very interesting to hear what you have to say. Maybe Timothy, to start off, could you explain or share with us what actually infectious diseases means? What does it mean? How do you define?
Infectious diseases and infectious disease basically means a disease that's caused by a microorganism. So it
Mm-hmm.
could be a virus, bacteria, a
Mm-hmm.
parasite. So these are called infectious diseases, whereas non-communicable diseases are diseases that are not because of a microorganism, such as heart disease or diabetes or hypertension. And infectious by the name of it means that uh, it can be passed on from person to person.
Okay. So it spreads.
Yes, yes, it can spread from person to person.
Okay. So and then
Yeah.
how do we differentiate between an infectious disease and a chronic disease? What's the difference?
These are different things because you can have a chronic infectious disease.
Right.
So when the term chronic means a disease that lasts long,
Okay.
so you do have chronic infectious diseases like HIV, AIDS, where the infection can last for a lifetime.
Right.
So that's what you mean by the word chronic. Chronic, the opposite of chronic is acute. Acute
Right.
means the duration of the disease is short.
Okay.
Chronic means the duration of the disease is
It's
long.
long.
So that's what we mean by chronic or acute.
Where does COVID-19 come in, Timothy?
So
How?
COVID-19 is an acute viral infectious disease.
Hmm. Okay. Hi, Timothy. I think we're having some technical issue. Are you there? Did I lose you? Okay, I think um, let's try and reconnect. We seem to be having a bit of difficulty. I'm going to try and get Dr. Timothy back online.
Yeah, sorry, I
Oh,
lost you for a while.
yes.
Okay,
So
now
you're
you're
back.
back.
Okay. So you were
Yeah.
explaining the COVID-19. You're explaining it to us.
So
That's where we lost you.
COVID-19 is an acute infectious disease. It's caused by a virus that is called SARS, SARS CoV-2, SARS-CoV-2, SARS coronavirus
Mm.
2. It's
Okay.
caused by this virus. Yeah.
Okay. There seems to be a lot of news, Timothy, now about. I mean, there's a lot of news daily, almost too much of information coming in, and we really don't know what's fake and what's real and what's the reality of the situation. And I think people, I mean, it's natural, we get attracted to negative news. We like to hear sad stories and bad stories. But what's the reality
Yeah.
of the situation?
Okay. First, let's just not call it bad or good news. Let's just deal with
Okay.
the facts of the matter.
Yes.
So the fact of the matter is this is a new infectious disease, a novel. It's called a novel infection, meaning something new.
Mm. Mm.
So anything new that suddenly causes many people to get ill and also death, it's not something good, all
Of
right.
course.
So we cannot equate it with other diseases because it's a new disease, and because many people do not have the immunity against this disease, the first and second sweep of the disease throughout the entire world populations will cause many people to get sick and even die when they normally would not have uh, absence of this new viral infection. So COVID-19 is no different. So any infectious diseases, all the infectious diseases, there was the first time
Right.
where the infection actually spreads throughout the world population. I mean, I think your audience may be interested to know this is not the first coronavirus to infect,
Really.
known to infect humans.
Mm.
It's not the first. There are actually altogether seven
Okay.
coronaviruses, and
Okay.
four coronaviruses already caused the common cold. The common cold is caused by four different types of coronavirus. And then in 2003, we had the
Okay.
SARS, and that's caused by a coronavirus. And
Right.
2011, 2012, there was the MERS coronavirus.
Right.
And now you have the
Right.
coronavirus 2019. Uh,
Right.
so we have had these types of novel coronaviruses before. And the interesting thing is, uh, it was predicted that the next outbreak uh, of a new
Mm.
pandemic would be due to a coronavirus.
Mm.
It was already predicted in 2015, 2016
Mm.
by even Bill Gates himself. So
Yes. Yes. Yes.
started off in at least for now, we think we started off in Wuhan, where in
Okay.
in, in or somewhere around December. Probably it would have started
Okay.
much more earlier. It's just that people didn't know about it, and now it's spread worldwide, worldwide, including
Mm.
our country and also in Sabah. So,
Mm.
and just within a few space of from January, now it's May. It's already. I'll just give you some figures. Let me just look so I
Mm.
can just give you the latest WHO figures
Please.
on
Yes. Please.
6th of May 2006. Globally, it has
Please.
already there are known confirmed cases. 3.5 million
Mm.
cases. 3.5 million cases, and it's already
Mm.
caused about 248,000 deaths since it started in January. So
Wow.
in 5 months alone, it's already caused what we know to be 247,000 deaths and 3.5 million people.
Mm.
Now, these are confirmed cases. The
Mm.
unconfirmed cases, the ones that have not been tested, is probably 3 or 4 times more than the confirmed cases that we have.
Mm.
So, in the past 4 years, this is a plague that has actually infected
Right.
humans. So, when people, it's definitely not good news, Prem. Okay, it's
Mm.
definitely
Yeah.
not good news. It is bad news, and people are rightly afraid and worried about something new. There
Mm.
are, I mean, in the world there are many diseases, but when something new comes out and that threatens us, of course, people will be worried about it, including
Mm.
doctors. And
Mm.
I'll just tell you why. What are the reasons why we are concerned with
Sure.
anything new? First of all, when a new disease comes out, we don't really know the full scale of the impact of it on the individual, on the
Okay.
humans. We're still trying to define what are the clinical features, what are the signs and symptoms. Of course, we do know that some of the signs that we fully grasp the full spectrum of the disease, the
Mm.
complications, how many people, what is the percentage of people who may die, what is
Mm.
let's say you get a disease, what's the prognosis,
Right.
what are the short-term effects, what are the long-term effects that it causes a person.
Right.
Who is going to get it. So when people hear all this news of people getting the disease, suffering, going to the hospital, and people dying, especially healthcare
Mm.
workers dying, so that causes a lot of fear. Rightly causes a lot of fear
Mm.
among people.
Mm.
So this is a disease. I think it is safe to say that for many of us in our lifetime, we haven't seen or experienced a disease like COVID-19.
Right, right, right. So
Yeah.
this is one of the worst experiences we've ever had globally,
Yes,
as
exactly.
far as the disease is
Exactly.
concerned. Right. Okay. Okay.
Yes, yes.
Um, we from a mental health perspective and from a well-being perspective, as psychologists and counselors and therapists in the mental health industry, lots of say going around, at the moment, like the more people getting depressed. I saw some statistics the other day in Malaysia. Apparently, there are 45 to 49 people percent of the people have reported depression and anxiety as a result of being at home, as a result of being locked down, during this whole MCO thing. But at the same time, I think, I mean, this is personally my view. I think this whole experience has made human beings more resilient. We become stronger because we have united to fight a common problem.
Yes,
So
yes.
when this is over, will we, well, human beings are social creatures by nature, right?
Yeah, yeah.
People like you and I, we sit down at the coffee shop, we drink a teh tarik, we love to do that, right? We love to sit
Yes,
down,
yes, yes.
eat roti canai, drink a teh tarik, and talk. Now we talk
Yeah.
through the laptops and we're talking through technology. What's going to happen when the MCO is lifted? How will people react? Are we going to continue to be afraid of each other? Are we going to continue distancing ourselves? How do you think this will impact humans actually overall? What are your thoughts on that?
Um, well, um, as you know, Dr. Prem, um, a lot of the predictions do not come true.
Mm,
Whenever you watch TV, people try to predict what's going to happen in the future, how people will react. The short answer is we don't really know how
we don't know. Mm,
people will react. But anyway, let me just explain to you what is the reason, the reasoning behind the MCO. What's the reason we have
okay.
these MCOs and the lockdowns in the first
Okay.
place? Okay, so when you have a novel virus, it spreads very easily, causing many people to be sick, and
Yeah.
and also a significant number of people who die. So when you get many people getting sick, thousands, maybe hundreds of thousands, what it does is it uh, exhausts the current healthcare system. It overwhelms
Right.
the healthcare system. So
Right.
what the actions are done is to try to keep the numbers below the level where the healthcare system is at its maximal capacity, something
Right.
known as flattening the curve.
The curve.
Uh,
Yeah.
that means the number of patients, the people who are getting sick, are within the realm where the healthcare system can cope. So if
Mm,
there's no form of control, the number of people are too many, the healthcare system gets overwhelmed. People don't get enough hospital beds, don't get enough doctors to treat them. The
mm,
ICUs are overwhelmed, and then many people would die, which they
mm.
would have otherwise not died had they got
Correct.
the. So that's the reason why we have the MCO, to slow down the spread, or
Mm,
as people may have heard, to flatten down the curve.
mm,
So now
mm,
that the curve has been flattened, and in many countries,
mm,
including Malaysia, the number of cases have been within uh, the ability of the healthcare system to cope, and the
mm,
government now is confident enough of it.
mm,
Then the MCO is being lifted in stages,
mm,
right? In stages. So what's going to happen after the MCO?
mm,
Uh, what's going to happen after the MCO?
mm.
Now, what is going to happen after the MCO? The virus is still there. The virus is
Correct.
still with us. So there will be cases. There will continue to be cases in
Correct.
our country. But uh, hopefully, what we hope is that the number of cases will be within the ability of the hospitals to
manage.
cope. So the MCO is a period where we can get ready. The healthcare system can get ready to be able to treat patients as they come in. So hopefully now, compared to 6 to 8 weeks ago, our healthcare system is more able to cope with the increasing number of patients. So what's going to happen is there will be more infections after the MCO is lifted because people are going out and they'll be infecting. But the difference now compared to before the MCO is that doctors know how to manage the disease properly because we have experience. Hospitals may have enough beds, hopefully, enough ICU beds, enough ventilators ready, and doctors have experience in treating this disease. New drugs are available. So that's on the medical and the treatment side. Now, as people go out, lifted from the so-called lockdown, we have to, at least for the time being, behave in a manner which is different compared to before this virus came about. Okay, our behavior has to change so that, to put it simply, so that we don't get infected or we don't infect others. Okay, the best way to reduce the number of cases is to make sure that we don't get infected and we don't infect others. So there will be behavioral practices and social practices that have to be different. So what are the behavior, our own individual behaviors that we have to change? Put it simply, when you go out, you, at least for the time being, you're advised to wear a mask, especially so if you are in a crowded area or where there are many people. That's number one. Number two is you need to distance yourself. Ensure there's a safe distance between you and another individual outside, at least 2 meters or at least 6 feet. The reason being is that when you cough or sneeze or things like that, the droplets can go right up to about 3 feet maximum, but sometimes up to 6 feet. So these are the two main things. And the third one is to ensure that our hands are always clean. That means we need to always wash our hands with soap and water. Now, it doesn't mean that you cannot meet people. It's just that when you meet people or your friends, you have to follow these practices, which you didn't have to before. So, for instance, last time when we go for teh tarik, we can be close to each other. We can sit next to each other. Now, the difference is you probably need to sit in front of me. And at least for the time being, we'll need to wear a mask. Wear a mask. Having said that, our main social activity outside is eating, isn't it? So that will have to change. Now, of course, you can't wear a mask and eat, isn't it? So there's certain times that is unavoidable it's unavoidable to wear a mask. So people may not. It'll take some getting used to wearing a mask whenever you meet your friends and all that. So when you see your friends or family members and all that outside, you like to see their faces, isn't it? You like to see them smile. You like to see their expression and all that. So how this affects people psychologically, as a doctor, I don't know. As a psychologist like yourself, it is something to be seen,
Yeah, it's something like you said. We really don't know.
Yes, we don't know.
We don't know how humans are going to react. We don't know. We can only predict a lot of things and be prepared. But honestly, it's difficult, really. Like I said earlier, personally, I think people will become more resilient. Even emotionally, I think people will become stronger. This is what I feel. But of course, there will be pockets. There will be groups of people who get unwell as well, from the anxiety and that stress as well. So it's very difficult to predict. I like what you said earlier, going back to what you explained, Timothy, which is very helpful, for people to understand that the flattening of the curve, actually, the whole objective is not to cure or treat, but to help professionals manage the situation better after this, right? Yes. And you also said that doctors would have had more experience managing this disease and with better vaccines, yeah? Now, does this mean that at some point of time, all of us may actually get this, like the flu, right? We all get a flu. Could it be possible that all of us will actually experience it at some point of time? Maybe next year,
Yeah.
maybe in time to come.
Actually, that is a very, very good question, because this virus can spread so easily. I think the question
Correct.
is, you see, within in December, in December, most of us, none of us ever heard of COVID-19. In January, a few of
Correct.
us. Now it's now in our own backyard, where people that we know have COVID-19. So,
Correct. Correct.
is there going to be a time that we may be infected?
Mm.
I think there's a high chance that at least someone you know will be infected because of the infectivity
Right.
of the disease. I think what your audience and everyone wants to know
Right.
is, if you get infected with the disease, what is going to happen? Okay, what is going to happen? Now,
Yes.
we have now, in order for us to face this disease, we have to keep have a proper perspective of the disease. Have a proper perspective of this. Now, it is a known fact by now. Now we know that almost about 80% of people who get this disease will only have very mild symptoms. Very
Okay.
mild cough, cold. They may not even need admission. Now,
Correct.
anyone who has the disease in Malaysia, we are admitting them to Malaysia, not only because of their illness, because many of them are not really sick, but as a method to prevent them from spreading it to others.
Okay.
Right? So they're not in the hospital because they're very sick. So in order for you to be admitted, you need to be very sick. But they're also in hospital to prevent them from spreading the disease. So about 80%, what we know for sure, 80% of people who have the disease, who have the infection, have very mild symptoms. Okay, very mild. Only about 1 in 6 will be sick enough that they need to be in hospital and need oxygen. Okay, need oxygen. Now, the next thing is, if a person gets the disease, what is the chance of him dying of the disease?
Right.
What's the chance of him dying? Now, it ranges depending on which country has it, and what other diseases you have, and what age that you have. Now, for the majority of people, for people who are less than 60 years of age, and who do not have any other disease, the chance of them dying is actually very, very low. It's less than 1%. Maybe I would say about 5 to 7 out of 1,000 might actually die. Not so for those above 60 and those above 80, but even then, from the published figures, those above 80, the percentage of people dying is about 15%. Of course, everyone dying is not good. So 15% of those above 80 may die of the disease. So people need to have a perspective of this disease. Now, everyone thinks now, I may be mistaken, many people may think if they get the disease, sure die one. You see?
This is the fear that now people have.
The fear of that causes anxiety, and the fear of severe illness also causes anxiety. So I'm not telling people to worry or not to worry, but just to know what the facts are. Right? So if you get a disease, there's about 80% chance that you'll just have a cough, a cold, or something mild for yourself. Now, the next point is very important. Now, you may it may be a minor symptom for you, but if you go home and you visit your father, your mother, your grandmother who is at high risk, they may get the infection and they may get very sick. So that's another cause of anxiety. So the question is, how do we solve it? The first thing is if you're unwell, then you stay at home. Don't go near any person who is of a higher risk of getting the disease, and try and isolate yourself. There will come a time where the government hospitals and the hospitals will not admit every single person with COVID. There will come a time where if you're having mild symptoms, you'll be treated as an outpatient. And when that happens, you need to go home. Nothing may happen to you, but you need to self-quarantine yourself and isolate yourself from other people who may get the disease and who may have a higher risk of dying. So, Prem, it is like this. One of the ways to overcome anxiety and worry is to know the facts.
Yes. Education is very important. I agree.
Yes. And why is it that people are so worried? It's because of the media. The media sensationalizes or just reports on all the deaths. So every day you hear how many thousands are dying, how many thousands are dying. So it's only natural that people, understandable that people are worried.
Right.
But we also need the media to also be able to tell people how many people are getting better, how many people have
Exactly.
mild symptoms, how many
Exactly.
people are going home. Why can't they show more pictures of people who are
Getting well. Yeah.
getting well and being discharged and happy
Mm.
and smiling? If every day
Mm.
you show pictures of people in ICU and dying and sad stories, so
Mm.
it's understandable if people be worried. So I'm not
Mm.
saying to worry. I don't think it's right to say to tell someone not to worry or be concerned.
Mm.
I mean, a person is going to feel what he's going to feel,
Mm.
uh, but to know the facts,
The facts. Yes.
and also to put the facts into context,
Mm.
and also to be able to put things into perspective.
Mm. I think I know I have to agree with you because whenever, even now as we are talking, I'm seeing the headlines popping out on the screen here about new cases of COVID being reported. The headlines is not new cases of COVID getting well. You're right. They're saying new cases of people getting infected, and this is quite scary. And of course, it attracts attention. People want negative news, bad news. Unfortunately, attract attention, lah. And people get excited with it, and then that anxiety kicks in, and the fear kicks in.
But the
So
fear of disease, Prem, Dr. Prem, is not only due to the disease, isn't it? It's all the financial, the loss of jobs
so many
as a
reasons.
result of COVID,
Yeah,
the inability of you to be able to see your loved ones.
yeah,
Families are separated. I can't see my parents as you can't see your parents. You
yeah,
can't see your
exactly.
parents face to face.
Yeah,
We can't. People who are for instance, Hari Raya is coming and people are
yes.
fasting now. They usually normally meet um, their family members.
Mm,
Some people are old, some people are sick, needing
mm,
company.
mm, mm,
So, uh, so people are anxious and worried not only because of the disease, but also
mm,
these other issues.
mm. There are psychosocial reasons, there are socio-economic
Yes.
reasons that have been
Yeah.
affected by this whole pandemic. That's so true.
Yeah.
I have friends who are now retrenched, and I know companies have closed down, and I know friends who have actually had to close down their businesses as well as a result of this whole thing. So
Yeah.
those are added stresses. Yeah, that's so true. Added
Yeah.
stresses that are beyond control. But
Mm.
what about a vaccine, Timothy? Do you think we will ever have a vaccine, and how's that?
Okay. I hope there will be a vaccine
Mm,
that will be available, but we haven't had a vaccine for the last two uh, severe coronavirus infections.
right.
In 2003, we had the SARS, which is also a coronavirus. It's already been 17 years. We don't have a vaccine for that. And in
Mm,
2011, 2012, we had the MERS coronavirus,
mm,
and it's been 7 years, and we still don't have a vaccine. Now,
mm.
what's the reason why it's not easy to get a vaccine? Is because the virus mutates. So the
Okay.
virus today may be a very different virus from the virus next year. So
Mm,
even in normal circumstances, if the virus doesn't mutate, it still takes time, a lot of effort to make a vaccine.
mm,
However, it is possible. The world has to come together to make the effort to create a vaccine. Normally, the vaccine development is done by private companies. Now,
okay.
I think if we want to make a vaccine, it should be a government effort.
Okay.
It's a very expensive investment, and private companies are not going to do it. But the governments have to come together and fund
Okay.
vaccine development.
Okay. Mm. But when you are saying SARS, and we have not found a vaccine for SARS yet, but we have
Yes.
managed to live with SARS, right? We have managed to learn to live around it, or rather, and we have moved on. So wouldn't it be possible, even with the COVID-19 situation, even without a vaccine, we will learn to live with it, and we learn to move on and function back again?
Yes. We will move on with it, whether we like it or not, Prem.
Yes. Yeah, we
Whether we
will.
like it or not, we will have to find a way of living with this virus, because it doesn't affect, as I mentioned just earlier, most people do not get infection, so they will get the infection, and uh, there is a hope, there is a possibility for, at least for the short term,
Mhm.
people who are infected will probably not get the infection again.
Okay.
At least
Okay.
in the
Oh.
short term, at least in the short term, because the virus mutates. So just
Uh,
because a person gets the infection one time doesn't mean you would not get the infection again. You see,
okay.
but at least in the short term, there will be a certain degree of immunity against the virus.
That
Uh,
particular virus, lah.
yes, that particular virus.
Right. Okay. But when it mutates, there's always a possibility that you can relapse or you may get it again, right?
Yes. Thankfully, most of the time, when a virus mutates, it tends to be um, less pathogenic.
Okay.
Meaning to say,
Okay.
causes less severe. Usually, causes
Uh,
less severity compared to the earlier one. Not
uh,
always necessarily so. Not always, but most
okay.
of the time. So it's our hope that as the virus goes from person to person, the strains become less and less pathogenic.
Oh,
It
that's
has been seen.
interesting.
There are strains. There are strains. Yes.
Oh, so it with time as the virus keeps hopping, from one person to person and all that, with maybe time, long time, is it possible that the virus becomes causes less damage than
Less
it's doing right now?
virulent. Yes.
Yes,
It is
huh?
possible. Yes. Less
That is
virulent. That's one thing that happens. The virus becomes less virulent, and
mm,
the population, as a general, develop an immunity
immune
towards the
system, right?
virus. Yes.
Ah, that's really helpful to
So
know.
Well, as I said, this is an evolving situation.
Mm,
So we don't really know. This is something that we hope, but we don't really know
okay.
that's going to
Okay.
happen because certain infections, such as dengue, dengue, for
Mm,
instance,
mm,
dengue, there are four different serotypes. So if you get one dengue infection from one serotype, you won't get dengue from that particular serotype. But if you
okay.
get
Okay.
dengue again from a second serotype, the infection is worse. You see,
Ah,
so
okay.
there are diseases where when you get the infection the second time is worse than when you get the first time.
Okay.
So with COVID-19, we don't really know. Okay, we don't really know. In the meantime,
Mm,
as of now, they haven't seen that many second infections. That means people getting the infections again. What they
mm,
have seen is that a person gets better, their virus levels are undetectable, and then later on it becomes detectable again. Now, whether
right.
they got infected again or not, we are not sure because the virus detection may just be remnants of the old virus,
Oh, okay.
RNA remnants, RNA from the old virus which they detect. Doesn't mean that they are being infected again.
Mm. So is that why sometimes we hear that patients who are infected, they're positive, then they get treated, they're negative, but after some time again, they're positive again?
Yes, they are positive again. So most of the time, it's usually the remnants of the old
Negative.
virus, the
Oh,
old virus DNA. So RNA, sorry. So just because you detect the RNA of the virus of the person, it doesn't mean that they have the disease again.
mm,
Because it can last
mm,
long. Interesting fact is even in the mummies in the Egyptian
uh-huh,
mummies,
uh-huh.
they've actually found uh, DNA of tuberculosis in the
Oh,
mummies after
mm,
these thousands of years. You see, it doesn't mean that you can get infected of TB. You see,
mm,
so in most cases it's like that. But still, Dr. Prem, is still an evolving situation.
yeah,
There may come a time where you may find reinfections of the virus. We'll
right,
just have to wait and see. Yeah,
right. Wow, thank you so much, Dr. Timothy. That's very educational, I must say. In fact, this
yeah,
is this is very helpful news for the public, for myself also. I've learned so
yeah.
much from you in the last few minutes. And I have to agree with you that educating and the facts, I mean, the facts are the most important thing, lah. Because
Yes,
we tend to be influenced so much by media or hearsay and a lot of fake news going on in WhatsApp and all that very often the truth is distorted and you don't know what's real anymore. Um,
yes,
right? This is
exactly.
really very, very helpful. Thank you very much.
Yeah.
I see that we have exceeded our 5 minutes by 5 minutes.
Okay, sure.
Sorry to take up your
Okay.
time. Um,
Yeah, it's nice talking to you and to share with
look,
your audience, the audience.
I'm sure we'll have lots of questions coming in, Timothy, and I will share them with you after this
Okay.
talk. Yeah, I'll send them to you. But
Okay,
before
sure.
we wrap up, what would you like to? I mean, is there anything you would like to share besides whatever you've told us so far? maybe more to the professionals out there. Anything you'd like to share with us? People like myself also in the mental health field. Is there anything you'd like to let us know to prepare for the post MCO? I'm talking about post after the MCO is over. Is there anything we should do or be prepared for?
Well, I think we what I feel that the health professionals need to say is to tell the truth and the facts as comprehensively as possible, so that the public will get a full picture of the disease, good and bad, good and bad. And then from that, then the public can decide what is good for them and why actions are being taken. Why is it that certain policies are being instituted? So the post MCO period just means that we have to learn that we have to live with this virus, take precautionary measures to reduce our risk of getting the infection. Don't forget there are other diseases, there are other infections, there are other diseases that we can get infected of. There are other dangers to ourselves, not only COVID-19. To have a proper perspective of this disease and to put it in proper context and to understand it. I think 20 minutes will not be adequate for us to discuss everything, but I suggest the public just go to the WHO websites or the Malaysian Ministry of Health websites. There are question and answers. And from that, with just about 5 to 10 minutes of reading, people will get a very good understanding of this disease, Dr. Prem.
Okay. I think that's very important. Go to the real facts. Check on the WHO website. Check on our Malaysian Ministry of Health websites. That's where we will really understand the actual facts of the situation. That helps us make better informed decisions. Okay. Again, thank you very much, Timothy. Thank you very much for your time. I must say again, this has been very educational for me as well. And I'm already thinking we should have you as a guest again the next time. This time, I'm thinking of the next time for us to have a group of 3 or 4 professionals, where we can sit down and share opinion and discuss. And I would like very much to have you again with us in Solace the next time.
Yes, thank you very much.
Okay, thank you again, Timothy, and you have a good evening and stay safe and be well.
Okay, thank you. Okay.
Thanks, Timothy. Bye-bye.
Okay,
Bye.
thanks. Bye.
I'll just,